morning. My name is Michelle Simones with Elite Medicare Management. I'm here to speak with you today about Medicare. I'm an independent licensed insurance agent in the state of Florida, and I've been having my license since 1999, and I am specializing in Medicare now at this moment. I'm here to talk to you today about parts of Medicare, exposures of Medicare, and then your Medicare choices. Things to consider when thinking about a plan are the premiums, deductibles, co-insurance percentages that you'll be paying, the max out-of-pocket costs to you, co-payments, and ancillary benefits. So different parts of Medicare, I'm sure you're most familiar with the Medicare Part A, which is hospital coverage. Most people are not going to have a premium for that if you've worked for at least 40 quarters and paid Medicare taxes. The things that covers under Part A is inpatient hospital care, parts of home health care, hospice care, skilled nursing facility, and mental health inpatient stay, along with some durable medical equipment. If for some reason you did not enroll when you were supposed to enroll, penalties can apply to the Part A coverage. Part A costs at a glance. Inpatient hospital stay. For each benefit period that you're admitted into the hospital for 2022, the deductible is going to be $1,484. The first 60 days is a $0 co-insurance per the benefit period. And each benefit period consists of when you don't have inpatient hospital care for a consecutive 60 days or more. So say, for example, you go into the hospital January 4th for 3 days, and then you come out, and then you go back in, say, February 2nd for another 3 days. That would be within one 60-day period. So that would be one benefit period. Another example is if you went in January 1st and then you went in July 1st and you stayed for the 3 days in January 1st, you would have to pay another $1,484 deductible because that would be outside of your benefit period. If you stay for days 61 through 90, then you would be responsible for $371 of your coinsurance per day per each benefit period. And over day 91, it's $742 per day of coinsurance for every up to 60 more days out of your lifetime. And then beyond your lifetime reserve days, you're responsible for all costs under Part A. Part A also includes, as we talked about, home health care. That is a $0 cost to you. Durable medical equipment is under Part A is covered at 20%. You're responsible for the 20%. Hospice care is $0. And skilled nursing facility, the first 20 days is at $0 cost to you. And then days 21 through 100 is $185.50 per day. You're responsible for all costs of greater than 100 days. Part B, medical, that is the second part to Medicare. There's Part A and Part B, which is referred to as Original Medicare. And the medical portion, the premium for 2022 is going to be $158.50, and that's your standard premium. You may pay less or you may pay more depending upon what your income is. Part B premium is dependent on your income. And again, you may have another penalty for Part B if you did not enroll during your initial election period. If you did not do that, the penalty would be 10% for every 12-month period you could have had Part B, and you did not. Part B medical costs are 80% Medicare will pay after the $217 deductible. And you pay the 20%, and there is no limit on that. So say, for example, if you have a $100,000 medical bill and you have no other insurance, you would be paying $20,000 after the $217 deductible. What does Medicare Part B cover? It covers any of your lab services. It covers parts of home health care that Part A does not cover. It covers the parts of durable medical equipment that Part A does not cover. It covers doctor services, including when you are in the hospital. It covers outpatient therapy, outpatient hospital and mental health services, along with some vaccines, including the flu, COVID, and shingles, is covered under Part B. Now, Part B has excess charges. Some of you may be familiar with this. What this means is Medicare has contracted across the country a 15% discount essentially on any Medicare or any medical care given. So say, for example, if you go to a doctor and you're under Medicare, the doctor is going to be billing or getting paid 15% less than if somebody who was not on Medicare. What this means to you is the doctor is allowed to charge you by law up to 15% over the Medicare agreed upon contract for care. So say, for example, if the doctor charged $11,500, Medicare would approve $10,000. The Medicare would pay that $10,000, and the extra $1,500 would be your responsibility to pay. There is no limit on excess charges as far as if you had $100,000, it would still be 15% of that $100,000, and it's going to be an unknown number, so it is important, whatever supplementary coverage you have, that it does include the Part B excess charges. If you are going with a supplement plan, note Medicare Supplement Plans F and G are the only plans that cover the excess charges, and Medicare Advantage plans are not allowed to have any excess charge billings. Original Medicare costs, what you can expect if you only have Part A and Part B. You have the Part A deductible, which is $1,484 per hospital admittance. After 60 days, additional fees may apply. The Part B premium you'll be paying, which is typically $158.50 monthly, depending upon your income. You're going to have the Part B coinsurance for any medical costs, which is at 20%, the Part B excess charges at 15%, and the Part B deductible at $217, which is once per calendar year. And then if you don't have any prescription coverage, you would be responsible for all of the prescription charges as well. So let's take a look at Medicare Part D, which includes the prescription drug coverage. These premiums vary based on plan and the income. There is a penalty for Part D if you did not enroll when you could have, and you are given a 63-day grace period to enroll into a credible coverage prescription plan. The prescription plans are tier-based, and formularies and tiers differ across all different plans. So each Medicare prescription drug plan has its own list of covered drugs known as a formulary. And then each year the pharmacists and doctors will update those formularies. All Medicare drug plans generally must cover at least 2 drugs per drug category, and plans can choose which specific drugs they cover. Plans are required to almost always cover drugs within protected classes, which include antipsychotics, antidepressants, anticonvulsants, immunosuppressants, cancer drugs, and HIV and AIDS drugs. Here is an example of a tier form. This was taken from Blue Cross, one of Blue Cross Blue Shield's plans. You have tier 1, which is the generic drugs. Those are typically going to be the most affordable and typically the most common. Then you're going to have tier 2, which is preferred name drug brands. Then you're going to have non-preferred brand name drugs, and you're going to have preferred specialty and non-preferred specialty drugs. Most formularies are going to have at least 3 tiers, and they can have maximum of 6 tiers, and they can be different from each plan. Most common covered drugs that are going to have low copays are listed here. And Part D prescription drug plan stages start off with a deductible, then initial coverage, and then you move to the coverage gap, which most people know as the donut hole, and then you move into catastrophic coverage, and then you move out into coverage resetting at the beginning of the year. So the deductible, the maximum deductible this year is going to be $445. Again, depending upon the type of plan that you have, it could be anywhere from $0 all the way up to $445. The initial coverage, you're going to have expecting to pay copays and coinsurance depending upon your formulary. The coverage gap limits this year is $4,430, excluding your premiums, but includes your deductible. So once you and your plan have spent that amount, then you will be going into the coverage gap. And in the coverage gap, you will be responsible for 25% of the drug until you reach your out-of-pocket maximum of $7,050. And that will include the cost of what the manufacturer pays towards your drug as well. Then you move into the catastrophic coverage, and the catastrophic coverage usually insures small copays and small coinsurance for the rest of the year. Now, one of the things that we do is we make sure to create a personal profile for you on Medicare.gov if you don't already have one. And we like to enter all of your prescriptions and your pharmacies so you know exactly what you're going to be paying and how to get the most cost-effective savings for you specifically. You go down and you could have the same prescriptions, and as you go down on Medicare.gov, you could have one formulary charging $3,000 and the next formulary charging $5,000. So it's important to analyze the different prescriptions like we do so you can get the best savings to you. It's also extremely important to look at your prescriptions when you have changes every year to again make sure that you're getting the best plan for you and saving the most amount of money that you can. Some common standalone prescription drug plan carriers are listed here. And your Medicare coverage choices, you have original Medicare Part A and Part B. You can add a Medicare supplement, or known as Medigap coverage, with a standalone Part D coverage. Or you can choose to have Part C, which is a Medicare Advantage plan, that replaces your Part A and Part B and is at least as good as or not better. Typically, most times they are better because they will include ancillary benefits and additional coverage. And then sometimes the Medicare Advantage plan most often will include Part D coverage as well, so you'll have your prescription plans all wrapped up into one plan. Here are some common Medicare Supplement carriers and some Medicare Advantage carriers. Here's a Medicare Supplement plan comparison. These are the different supplement plans that you can have. Like I said previously, F and G are the most common. If you were eligible for Medicare prior to January 1st of 2020, you can have Plan F. After 2020, January 1 of 2020, unfortunately, you are no longer eligible for Plan F, so Plan G becomes the most comprehensive supplemental plan for you. Like we talked about before, they are the only plans that cover full excess charges. And then most people who have a supplement plan will opt for Plan G. So it covers your Medicare approved expenses. This is an example, if you had Plan G, what your predictable costs could be. 100% coverage minus your $217 Part B deductible. Your Part A deductible is covered. Your Part B deductible is not covered like we talked about. Your Part B coinsurance is 20% is covered fully, and your Part B excess charges is covered fully. So a Medicare Supplement Plan G with Company A has the same benefits as Medicare Supplement Plan G with Company B. It just depends upon the pricing. Each company is going to have a little bit different pricing. If you have original Medicare with a supplement and a standalone prescription drug plan, you can expect to pay the Part B premium, which is $158.50. Again, that's dependent upon your income. Medicare Supplement Plan G will vary. It pays 100% of Medicare approved charges. Your Part B deductible of $217, which is one time per year. Your prescription drug plan premium will vary, and your prescription drug plan the deductible will vary as well. Now, choosing your hospitals and doctors. With a Medicare Supplement Plan, you can choose any doctor that you want to or hospital within the U.S. as long as they are contracted with Medicare. There's no referrals needed. However, Medicare does have some prior authorizations that are needed for some particular services. With a Medicare Advantage plan, it works a little bit differently. You'll be required to go to any hospital or doctor that accepts that specific plan's network. So what do you need to know about Medicare Advantage plans? There's two types of Medicare Advantage plans. There's an HMO and the PPO. The HMO is typically going to be richer in benefits because they're going to be a little bit more restrictive. I say you're a little bit more restrictive because typically they will not honor out-of-network benefits unless you are traveling and it is an emergency situation or an urgent care situation. For example, if you went to a doctor and it was out of network, you would be responsible for 100% of those costs, whereas with a PPO, if you went out of network, as long as that provider agreed to accept that particular PPO provider, then you could go to that plan and you would just pay a little bit higher of a premium. And that is one misconception that a lot of people have about PPOs. They think that they can go to any network provider because they have out-of-network provider benefits. However, you do want to always double check with your provider because just because you have out-of-network benefits does not mean that the provider will accept the benefits. So that's very important to check with all of your doctors, which is something that I would help you with if need be. So Medicare Part C is run by private insurance companies approved and under contract with Medicare. They're not allowed to charge any excess charges. It provides your Part A and Part B coverage, and most often will provide your Part D coverage as well, so it's all wrapped up into one plan. They typically will offer extra coverage to be competitive. They'll give you a dental allowance, vision, hearing, over-the-counter, and oftentimes a gym membership and the prescription drug membership. Costs for items and services may vary by plan. Copays or coinsurance until MOOP is met. For example, on one plan you might have a $10 copay to go see a primary care physician, whereas on another plan you may have a $0 copay for a physician. So it's also important to really look at the plans and see how much you're going to be using the medical care. Part C plans are using your medical care as you need it with a financial safety net, a maximum out-of-pocket cost. Whereas a supplement plan is you're going to be paying that monthly premium no matter whether you're using your health care or not. Typically the Part Cs do not have monthly premiums, so you're just going to be paying as you go to the doctor. Every time you go to the doctor, you'll have a copay. Every time you go to a specialist, you'll have a copay. However, some plans will have $0 copays in some instances. So it also depends upon your health, and that way if your health changes on a year-to-year basis, it's also important to always do an annual review of your plan to make sure you'll still be on the most cost-effective plan for your situation. The Medicare Advantage costs with prescription drug coverage, you can expect to pay your monthly Part B premium. The Medicare Advantage premium varies. Oftentimes they are $0. Medical copays and the coinsurance percentage you'll be responsible for until the maximum out-of-pocket is reached. Typically a maximum out-of-pocket, depending upon if you're on an HMO or a PPO, is going to be around $3,500, as low as $3,500, all the way up to possibly $10,000 for out-of-network coverages with the PPO. You have your prescription drug plan deductible if your plan has a deductible. And like we talked about, most plans will offer the extra benefits like routine and comprehensive dental, vision, hearing, gym memberships, and over-the-counter benefits. There are dual eligible plans. Those are designed for people who are on both Medicare and Medicaid. They're going to offer increased benefits to your plan. It could increase additional benefits to your dental, your vision, your hearing, and over-the-counter. If you are a veteran, your first option is to have Medicare Part A only and use the VA for your health care and drugs. The second option is to have Medicare Part A and Part B with either a Medicare Advantage plan or a Medicare Supplement plan. Oftentimes veterans will do this if they want to use both the VA and private health care for a second opinion, or if you're a veteran and you just don't want to go to the VA, then oftentimes they'll opt for a Medicare Advantage plan or a supplement plan. If you do have TRICARE for life, then you do have to have Medicare Part A and Part B. That is a requirement. If you have Medicare Advantage plan without a prescription drug plan coverage, you can expect to pay your Part B premium, which is typically $158.50. Your Medicare Advantage premium is going to vary like we talked about. Most oftentimes they're $0. Your medical copays and coinsurance percentage you'll pay until your maximum out-of-pocket is reached. And most plans will offer extra benefits like we talked about. And ideally, these plans are going to be for veterans with prescription drug coverage through the VA, so they don't need that portion or that benefit of the plan. And these plans typically offer a reduction in Part B premium and will help pay your Part B premium as a thank you for your service. And Medicare Supplement versus a Medicare Advantage plan. So the supplement plan, like we talked about, it has higher premiums. You're going to be paying that premium every month, no matter whether you go to the doctor or not. But you're not going to be paying copays when you go to the doctor outside of that $217 deductible. So a Medicare Supplement plan is very predictable. You pay no matter whether you use it or not. You have the freedom to choose your doctors and hospitals. No referrals are necessary. But please note, Medicare does require some prior authorization for some services, so that will be standard practice. Some routine services are not going to be covered. You won't be getting the extra ancillary benefits like the dental, the vision, the hearing, or the over-the-counter or the gym memberships. And you are covered anywhere in the U.S. Whereas a Medicare Advantage plan with prescription drug coverage, you're generally going to have the lower premiums, but you're going to pay for the copays and the coinsurance every time you use your health care until your maximum out-of-pocket costs are reached. You are going to be restricted to a network. You may need referrals for specialists. Some may include extra benefits like the dental, the vision, the hearing, the fitness, the over-the-counter. And emergency services are allowed only outside of your service area, which includes urgent care. Now, it is important as well to look at your Medicare Advantage plan and see what kind of a network you need as well to check if all of your doctors are in that particular network. And then some networks like United Healthcare, they actually have no boundaries on their HMO. That's something new for 2022. So they have the ability to have nationwide coverage as long as it has a contract with United Healthcare. So say, for example, if you wanted to go to a doctor over in Tampa, you could do so as long as they were still in the network with United Healthcare. So Medicare Advantage plans some of them have gotten really good at offering additional coverage through an HMO, traditional HMO. So if you want to transition from a Medicare Supplement plan or a Medicare Advantage plan, if you go with a Medicare Advantage plan, you have 12 months to go to a Medicare Supplement plan on a guaranteed issue from your Part A effective date. If you do not make that move and you go to a supplement plan after 12 months, then there is going to be underwriting that's going to be required. If you remain on the Medicare Advantage plan longer than 12 months, you would have to qualify health-wise for the traditional Medicare Supplement plan, and you can only enroll October 15th through December 7th. If you stay on a Medicare Supplement plan longer than 12 months and wish to go to a Medicare Advantage plan, you do need to wait until the annual election period, which is typically always October 15th through December 7th. We do offer available all of the Medicare plans and all of the Medicare carriers in the industry. I am independent, so I am licensed with different providers. We do shop all of your Medicare plans and your prescription drug plans to make sure your doctors and your prescriptions are going to be covered and to get you the most cost-effective plan available. We are accessible. I give you my personal cell phone number as well as email, so you will be able to call me if you have questions in regards to anything that might come up. And we work for you, not the insurance company, so we hold no bias with which company that you go to. Thank you. My cell phone is 321-608-1979, and if you prefer email, my email is benefitspecialist@gmail.com. I hope you found this helpful, and it was a pleasure being able to speak with you today. Thank you.